There's a lot of folks out there with chronic pain, chronic fatigue, and depression. Maybe that's you, maybe that's someone that you love and care for. Either way, it can be a very complicated situation that can go on for a very long time and really take its toll on people. My goal with this video is to just help to disseminate information, try to dispel some myths, and boil things down. I know that it's never simple, and let nothing that I say here today give you the impression that I think that this is easy to figure out, that you should have figured it out by now, that it's just a matter of doing 1, 2, 3. None of that is true. If you're watching this video, if you have chronic pain, chronic fatigue, you probably tried a lot of things already. You go through phases of getting motivated and trying lots of stuff, and then things don't really work the way you wanted them to. You lose energy, you lose motivation. You kind of like, well, I kind of can just manage this on my own for a while. I understand that predictability is enormous with chronic issues. Do I know what I'm going to feel like tomorrow? Can I make plans for Saturday because I know what I'm going to feel like Saturday? So making any changes can be threatening and difficult. So I'm just here to share information that I have gleaned working with patients in this community over 25 years. Lots of folks with chronic pain, fatigue, and depression, co-treating with the medical community, acupuncturists, naturopaths, really trying to keep myself connected to lots of different people in the community so I can be a resource and connect my patients to those folks as well. So a lot of this is stuff I have gleaned from patients, from treating them, and from also asking them about things that have helped and worked for them over the years. So here we go. Depression, pain, and fatigue, the three things are very much interchangeable, and if any of the three are there long enough, you're going to have all three. Depression causes fatigue, and fatigue leads to pain. And pain can be depressing and tiring. So just even having chronic pain can cause depression and fatigue. And then fatigue, if you just don't have enough energy, you can't do the things you want to do, you can't engage in life in the way that you want to, that leads to depression and eventually pain. By the way, if you don't know me, my name is Dr. David Russ. I'm a chiropractor. I practice in Portland, Oregon. Welcome to my channel. If you like this video, please subscribe. We appreciate it. I may be sharing with you some recommendations for supplements. If you are buying supplements and you want to support my channel, there's a link in the video description to my full script dispensary. I get a little commission if you buy supplements through there. Shipping is fast. Free on orders over $50. The selection is enormous. And if you need help selecting things, you can reach out to me. So what are we trying to do here with this video? Number one, just disseminate information. Number two, try and let folks know what is possible. There may be some tests, there may be some interventions that you're not aware of. If you watch this video and you get 1 or 2 things that helps you in the future, I'm happy. Let's try to think a little differently about this situation and these conditions that you have. And I have learned over the years that the word cure with chronic issues can be very loaded and often not appropriate. So I don't use the word cure. Maybe we could say heal, but heal is something that you do. It's not something that someone does to you, but really help. Can we lighten your load a little bit? With chronic pain, chronic fatigue, depression, if we can make a dent 20, 30% is huge in a person's quality of life, their predictability, their capability and adaptability. And I know that's what you want. Sometimes even 60% can really make a significant change, even if things aren't ever all the way better. Making them a lot better helps enormously. And I know how much that can help. Let's get into it. What contributes to these issues? And we're not talking about causes or events that start it. We're talking about what's going on in the body, and in no particular order, not necessarily importance or prevalence, but just the ones I thought of it. First, we'll say systemic inflammation. Inflammation in the body. It may be something you can see. You're puffy, you're swollen, you have edema, or it may be internal, or it may be just localized. You may not be able to see it at all. Your body may have sort of adapted to it and accepted it as normal, and it doesn't show up on blood tests, but it can still be happening. And that can happen from a number of causes. Allergy is a huge cause of systemic inflammation. whether those allergens are in the air, in the environment through contact, or most commonly in food. The prevalence of food allergy has really exploded in the last 20 or 30 years. A constant or consistent exposure to your allergens will create an immune response in your body, which will lead to systemic inflammation. Also, other than allergy, is infection. Sometimes infections go chronic, especially in the digestive system. You can have chronic bacterial or protozoan parasitic infections in your gut. You can have chronic viral infection anywhere in your body. We all know about the herpes simplex 1 and 2. Well, once you catch it, you have it forever. Whether it's expressing itself in a sore or not, you still have it, and your immune system is having to keep it at bay. There's a lot of viruses like that once you have them forever. Repetitive injury is a huge cause of chronic pain, which is a little bit distinct from most of what we're talking about today. Most of this video is about the metabolic type of chronic pain and fatigue, but there's repetitive physical injury, especially to discs in the spine, that can just go on for months and years and create pain after pain after pain, which leads to fatigue, which leads to depression, which increases the fatigue and the pain, and so on and so forth. Autoimmune disease is also very prevalent. Lots of folks have it, lots of different types. None of them really are curable, just manageable. And then a lot of the control of inflammation in the body is based on hormones, particularly cortisol, which is an adrenocortical hormone that is our body's main anti-inflammatory. And we can have problems with our cortisol just like we can have problems with any other hormone in our body. And that can lead to systemic inflammation. So after systemic inflammation, there's nutritional problems. Deficiency in the diet. You're just not getting enough, let's say, vitamin B12, or poor absorption. So you may be eating it, but you're not able to digest it and then suck it through the intestinal lining so that your cells can use it. And sometimes you may be getting enough of it in your diet and absorbing it pretty well, but some people are just not that good at using certain vitamins and minerals. And we'll talk about that a little later. So dietary problems, people just not getting enough nutrition. Gut inflammation kind of ties into that systemic inflammation thing we were just talking about. Chronic inflammation of the gut leads to a thickening of the gut wall, and stuff can't get through because it's kind of full of mucus and edema, and it just doesn't diffuse as well. Food allergy, which we were talking about allergy before, food allergy can cause a lot of inflammation in the gut. Dysbiosis is a big word for just having bad bacteria and yeast and fungus living in your intestines. Sometimes nowadays it's called SIBO for small intestine bacterial overgrowth. I think dysbiosis is a better term because it really encompasses anything that's going on in your gut where the wrong types of organisms are predominating. And then there's genetic issues. Some people are just not as good at absorbing calcium, not as good at absorbing and metabolizing iron, not as good at absorbing and metabolizing B12 and folic acid. So systemic inflammation, nutrient deficiency and malabsorption, and we saw those two are very closely linked. And number 3 is a large term called aerobic deficiency. Simply your body isn't getting enough oxygen or isn't able to use that oxygen to create energy for your cells to use. And if your cells are tired, you're tired because you are just your cells. So what causes these types of aerobic deficiencies where there's just not enough oxygen? Well, number 1 is the different types of anemia. The two main are iron deficiency and B12 deficiency, and these are pretty easy to find on blood tests. So if you have had blood work and your iron and B12 look good, this doesn't apply to you. But for some people, not enough iron in the diet or not able to metabolize that iron means your blood can't carry as much oxygen. For B12, it's the same. Not enough in the diet. B12 is only found in animal products and some nutritional yeast. And if you're not getting enough or your body doesn't metabolize it well, your red blood cells, which carry oxygen, they don't ever really mature all the way. They need B12 to mature all the way, so they can't carry as much oxygen, and you're anemic and your cells don't get enough oxygen and they just can't make enough energy to keep up with your day-to-day. You get tired, you get depressed, and then pain shows up. Another biggie, which is kind of more in my wheelhouse as a chiropractor, is breathing pattern issues. People carrying a lot of tension in the rib cage and the diaphragm, in the neck and shoulders. It literally decreases their ability to breathe in air and breathe out carbon dioxide. That will lead to an aerobic deficiency, not enough oxygen if you're not breathing. And then there's folks with respiratory diseases, COPD, asthma, and so forth, where it's just impossible for their lungs to take in enough air and exchange oxygen and carbon dioxide due to some other underlying disease. That leads to fatigue, that leads to depression, that leads to pain. So we talked about systemic inflammation, we talked about nutrition, we talked about oxygen, and now we're going to talk about metabolic issues. Things like low testosterone, things like adrenal fatigue, things like hypothyroidism or Hashimoto's disease, which is so common. Things like diabetes and other blood sugar issues, where the cells in the body cannot count on a nice constant supply of glucose to burn for energy, and they get tired because there's just not enough fuel for them to burn. There's genetic issues, and we'll talk about a really big one later in this video called methyl tetrahydrofolate reductase, which is a long word for this enzyme that's involved in B12 and folic acid metabolism, and which about 20% of us in North America have a deficiency, or a genetic defect in the creation of that enzyme, and we don't metabolize B12 and folate, which leads to all kinds of problems with brain chemistry, thyroid hormone, energy production, joint health. It's a crazy domino effect that we'll talk about a little later in the video. And then another biggie for metabolic issues is detoxification. Now, I know this raises a lot of skepticism for a lot of people. You know, why do I need to take detoxification supplements? My body detoxes just fine on its own. There's no such thing as toxins. Well, that's ridiculous. Detoxification is the metabolic pathway of converting a molecule and a chemical from one form to another, from an active form that's going to have an action on your cells to an inactive form that's safe for you to excrete. And you do that all the time with your own hormones, estrogens, progesterones, all kinds of things that your body makes in there need to be excreted, and they need to be converted to a safe form before they can be sent to the kidney. That's detoxification. You drink a beer, there's alcohol in the beer. Alcohol is a poison. Your body needs to metabolize that alcohol through a bunch of different steps in order to make it safe to send to the kidneys to excrete. One of those intermediate steps is formaldehyde, which is extremely toxic. And if you're having a little trouble with those steps and formaldehyde accumulates, guess what? You're not going to feel really good. So metabolic issues is huge. And then the fifth one is mental, social, and emotional factors, including this epidemic of isolation and boredom that people have. We're all experiencing this right now. Epidemic of anxiety, mood issues, depression, mental illness, diagnosable mental illness, bipolar disorder. A prolonged depressive episode can wreak havoc on a person's health, as can a very high and prolonged manic episode. People not making great decisions wind up with chronic illness as a result of things that they have done. And then trauma, physical trauma leading to chronic injury, leading to chronic pain, leading to fatigue and depression, and the mental emotional side of trauma, which is PTSD. This very complex issue. Growing up is traumatic. Lots of people would relate to their own childhood as a traumatic experience. Whether you would agree with their relation or not is not relevant. It's about how a person experiences it and what the effect is on their brain and on their body and how they see the world. And these things can be the initiating factor to depression, fatigue, and chronic pain. So let's look at an example of how this whole thing can start, and often does start. And in this example, we're going to say it starts with a person overworking. The job becomes very demanding, and that's unavoidable a lot of times. You may be a farmer And if you're not out there tending to your crops and harvesting, then you're going to lose your whole season's worth of work. You're going to have to work 12, 14, 16-hour days, many days in a row, or whatever the case may be for you. Overwork happens. So persons overwork, they get stressed out and they get tired. And one of the things that your body does when you're stressed and tired is it secretes cortisol. We talked about that before. Cortisol comes from the adrenal cortex. It kind of gives you a little pep. It pulls some sugar from storage for your body to burn. It increases your vigilance and situational awareness. It's a stress hormone. Eventually, if you keep stressing your body without enough rest and regeneration, you're going to start to run out of cortisol. You're going to start to run out of the raw materials of cortisol, DHEA, pregnenolone, cholesterol, things like that that go into making cortisol. You're going to run low. And when you start to run low, your cortisol starts to depress. Your body can no longer come up with the oomph that it used to come up with to get you out of bed and through your 12 and 14-hour day. Now, decreased and depleted cortisol has effects in the body. The two biggest effects we're going to talk about now are immune. Number one is secretory immunoglobulin A, or SIGA for short. The best analogy I've ever heard of SIGA is it's like the Scotch guard on the inside of your mouth and your digestive system. It is a first physical barrier against infection from bacteria and viruses and other microbes. And SIGA is dependent on cortisol in order for its existence. If cortisol gets depleted, SIGA starts to go down, and now you, on your insides, are more exposed to viruses, bacteria, and other microbes to settle in. And you may not even feel sick at first because it may not be pathogenic in small amounts, but if it is able to hang out and establish a foothold, it's going to start to predominate, and then over time is going to make you sick. It's going to lead to allergy. As your immune system starts to come into your gut in order to fight this microbe, you're going to have a lot more immune activity in your gut, which is going to lead to local inflammation, thickening of the gut lining, malabsorption, and also may lead to hyperimmunity, which we know of as allergy. So now we have chronic stress and fatigue led to cortisol depletion, led to an allergy and infection in the gut lining, which leads to fatigue, systemic inflammation, malabsorption. Malabsorption, you're not now able to absorb the things that you eat. Your body and your cells are not getting the nutrients it needs. That's going to make you more tired. The inflammation over the really long term is going to cause leaky gut, where proteins and other larger molecules that are not supposed to be able to cross your gut barrier are going to come into your bloodstream, and your immune system then has to deal with them, which creates more allergy. So it's this incredibly terrible self-feeding cycle. Fatigue, pain, inflammation, and depression are all going to eventually result. Some people can work harder for longer. Some people can't. That's about genetics. It's about all kinds of things. But everyone has their tipping point, and for some people, it's less than for others. So let's say this person comes into my office. By this time, they're talking about headaches. They've got sleep problems. They have indigestion, which maybe has been diagnosed as IBS or ulcers, or maybe they do have H. pylori from chronic gut inflammation. They have joint pain, and they're sad because all of these things are in the way of them doing the things they need to do and want to do in order to be happy and lead the fulfilling life that they want. So we look at three things, okay? This is what I suggest you do, whether you work with me or not. And if you want to work with me, there's a link below to my website, and book now. We'll do a telehealth appointment and we can talk, see where you're at and what we can do. So what do? We look at first, worst, and easiest. What was the first symptom? When did this start? Okay. Did this start because you overworked? Sometimes it starts with a severe deep infection. I have a chronic pain patient that I work with who the whole issue started with pneumonia, and that pneumonia just completely knocked him for a loop, and that was almost 20 years ago, and he's still recovering. He's a lot better. But when did it start? Physical trauma, infection, overwork, mental, emotional trauma. Let's just kind of see where it started, and sometimes working from there and working on that issue helps to kind of resolve the whole pattern. Number two, what is your worst symptom? What are you dealing with that has the greatest impact on you? Is it your migraines? Is it your foot pain? Is it your back pain? Is it your mood? Let's immediately go to work on that and try and make that better, because that's going to have a huge impact on your quality of life. And then number three, is there anything easy that we can work with? You know, all of this other stuff, and my neck is stiff and I can't turn to the right. Well, a lot of times that's just a session or two of myofascial work and an adjustment or two, and we can restore movement to your neck and help you feel better. Or maybe it's jaw pain or who knows what. But if there's a physical pain that can be helped with manual therapy, let's do that. Let's get that out of the way. So what do we use to assess folks with? How do we figure out what's going on? And I'm going to list 5 here for you today that are non-manual, just laboratory assessments that have made a huge impact on my patients' lives in the past and which I do continue to use. Okay, we'll go through these one at a time. Number one is the adrenal stress index. The adrenal stress index measures mostly your cortisol levels throughout the day. You take 4 readings, and it's not blood, it's saliva. You get the test kit at home. You do it in one day. You take a reading at about 8 a.m., about noon, about 4 p.m., and then about midnight, and most of us aren't up that late. But you get a sense of how does the cortisol fluctuate throughout the day. They're also looking at SIGA, because it's a salivary test. The SIGA is in your saliva. We talked about that before. It's closely related and needs cortisol in order to be there. We can test your SIGA. We can test your insulin, and we also test for gluten antibodies, because gluten intolerance and allergy is unfortunately very common. So a nice thing about this test is it gives us an overall view of how your body is responding to all of the stressors that's placed upon it. It's pretty easy to do, and it's not that high cost. So this is something we can do kind of as a landmark every few months as we're working through chronic issues to give us a sense of how you're doing and how your body is responding to stress. Here is a sample test. This happens to be mine from last year. I was dealing with some stress. So the green zone is the normal or ideal cortisol curve. Highest in the morning when you're waking up is when your cortisol is highest, and then decreases throughout the day and has to be low at night in order to allow you to sleep. Because remember, cortisol as a stress hormone, it wakes you up. A lot of people with insomnia have dysregulated cortisol, and their cortisol's too high in the evening. They're not able to fall asleep. I call that the tired and wired syndrome. So as I look at this for myself, I can see that I'm pretty good. I'm a little low in the morning, and I'm good for the rest of the day. But this gives me ideas of interventions that I can do to help to boost my cortisol in the morning naturally, not with caffeine, but with evening exercise, morning exercise. And it turned out that morning exercise is really kind of the key for me all year round. Can I get some sunlight? Can I get my heart rate elevated in the morning? That really helps me for the whole rest of the day. The next test I'm going to talk about is the UAT, urinary organic acids test. You pee into a test tube, and we send it to a lab. And they can assess for dozens and dozens of biomarkers in the urine. This is a fabulous test. I discovered it. I learned about it about 10 years ago, and it changed my health and the health of my kids and many of my patients. So metabolism, so energy production, detoxification, upper GI infection. We'll talk about the stool test in a little bit, where you can detect lower large intestine infection, but a stool test will not find an upper GI small intestine infection, but a urinary test will. And the reason is that the small intestine is so absorptive that whatever byproducts the bacteria or fungi are making in your upper GI, in your small intestine, you are going to absorb. A, they're probably going to make you sick, and B, you're going to pee them out through your kidneys. And so if we see it in the urine, it means that the bacteria are living in your small intestine. And we have found some very difficult to find chronic bacterial and yeast infections and colonizations in the small intestine, which were making people super sick. You can also get a sense of brain chemistry and energy production using the urinary organic acids test, and I'll show you how that is. I think it's really cool. Skip forward a couple minutes if this is boring you, but you may have heard of the Krebs cycle, also known as the citric acid cycle. It's famous in biochemistry. This is how we burn sugar, through the citric acid cycle. And we get most of our cellular energy through the citric acid cycle. If we look close at it, we can see, for example, this down here, where the red is, it says succinic acid, and that gets converted to fumaric acid. Well, let's say there's a deficiency in the enzymes or not enough cofactors in order to make the succinate to fumarate transition very smoothly. Well, you're going to get a buildup of succinic acid, and you're going to see too much of it in the urine. So if there's a buildup in the body and it's coming out in the urine of, for example, succinic acid, we know that your citric acid cycle is having a hard time spinning and you're not making enough energy, and that could be a root cause of your fatigue. And we know exactly how to facilitate and smooth that transition from succinate to fumarate. So to kind of kickstart your Krebs cycle and get it going again, most of the time it's a good activated B vitamin. It can be enormous for energy production. But you can have deficiencies of enzymes and cofactors in any of these steps in the citric acid cycle, or in any step of any metabolic pathway in your body. So we're looking for key biomarkers that show buildup of certain metabolites, which indicate difficulty with certain transitions, which can then be addressed with functional nutrition. It's a really elegant way to assess for metabolic issues. You get in the report for the UAT test is really great. They give you not only the results, but also your nutrient recommendations. We can see here on this one that they're recommending vitamin B2, B3, and biotin, as well as glutathione, not as urgent, more in the yellow, and B1. So you can look at this report and get the raw data, but you can also get the interpretation, which I always verify with a textbook if I'm not 100% sure, but is really super helpful to get us pointed in the right direction. Here's another slide showing some of these raw data from the urinary organic acid test. Let's zoom in on this part, which are the neurotransmitter metabolites. So how can your pee tell you about your brain chemistry? Like I said before, if there's a buildup of certain metabolites and it's excess in the urine, that tells us a lot about the chemical processes going on, converting serotonin and dopamine and trying to keep your brain chemistry in line. And all of these things can be addressed, usually with non-pharmacological nutritional supplementation, usually pretty cost effectively as well. Again, we're not talking about a cure necessarily, but it can help. Here's a great slide that shows the yeast and fungal dysbiosis markers. For example, the D-arabitinol, if it's in your body in significant quantities, it's from Candida yeast. Now, Candida is famous for oral thrush and vaginal candidiasis, but it'll very happily live in your small intestine or your large intestine and wreak havoc with your health. The arabitinol is not the only metabolite. We all know that yeast ferments sugars into alcohol. There's a lot of people out there with a brew or a distillery in their intestine. They have enough yeast that is metabolizing the sugar that they eat into alcohol, and they're walking around constantly depressed due to low levels of alcohol in their bloodstream, depressing their brain function and also stressing the heck out of their liver. So let's find the candida and the fungi in your body, and let's take steps to get them out as much as possible. So that was the urinary organic acid test, a favorite. Number 3, and this one's harder, is food intolerance and food allergy identification, which there are blood tests you can do, blood spots, and blood draws. I find that information to often be very confusing and overwhelming. I've had lots of folks come to me with food allergy tests and IgG tests they're just allergic to everything. And they're like, I literally cannot eat anything. Okay, that's not true. when you see that, if your food allergy test, your IgG 90 food test or whatever, you're allergic to everything, you have leaky gut and your immune system is in hyperdrive, and you're gonna have to scale back your diet really significantly for quite a long time in order to rebuild that. But no, you're not actually allergic to everything. You're just in a hyperimmune state. So unless you're really suffering with major digestive issues, then most of the time food elimination and reintroduction will take about 8 weeks. And I won't get into all the details, but you just sort of cut a lot of the common allergens out of your diet, and here's the list of them for at least a month. Yeah, for at least a month you eat an extremely boring diet, and then you start to add things back one at a time and you see how it feels in your body. It's a really great way. To me, it is the gold standard of how to find out what you're intolerant to, because there's other intolerances that exist that are not allergy that will never show up on an IgG test. Great example is lactose intolerance. There's no allergy to milk or casein or whey or milk proteins with lactose intolerance. You just don't digest that sugar, lactose, because you don't have the enzyme. And so the bacteria in your gut digest it, and they make lots of carbon dioxide and other things, which gives you huge gas and cramps, and you absorb that carbon dioxide, it makes you tired. And just an example of how intolerance can be non-allergic, would never show up on an IgG test, but can still be horrible. Let's talk about more standard labs, and a very common one that people get run when they're fatigued and depressed is a thyroid panel. The typical thyroid panel, unfortunately, is one hormone, thyroid stimulating hormone, or TSH. That is not nearly enough, not nearly enough. Let me explain why. If you've had your TSH tested and your doctor said your thyroid's fine but never did any other tests, watch this part, okay? So the way that thyroid hormone and TSH work together, TSH is thyroid stimulating hormone. It comes from your pituitary at the base of your brain. It gets released into your bloodstream. It goes to your thyroid gland and it stimulates the release of thyroid hormone. The presence of thyroid hormone in the blood percolates to the pituitary, which then tells the pituitary to stop secreting TSH. So TSH stimulates thyroid hormone and thyroid hormone inhibits TSH, and there's other steps in the process too, but that's the basis of it. So the conventional wisdom, which is completely incorrect, is that if your TSH is normal and not too high, that's because your thyroid hormone is normal. Because if your thyroid hormone was low, your TSH would be high. And if we just look at your TSH and we see that it's normal, we know everything is okay. Well, that's wrong. There's a lot of other things at play, not surprisingly. By the way, a good, complete thyroid panel is like $200, okay? It's doable. So let's look at some of the other things that need to be looked at. Number one, there are many forms of thyroid hormone in the body. The two main ones are T4 and T3. So T4 is what your thyroid secretes. It's called thyroxine, and it's not active. It needs to be turned into, again, here's another enzymatic reaction, into T3, or triiodothyronine, which is the active form. In order to make that conversion, you need to have enough selenium cysteine, and you need to have a few enzymes around in order to make that conversion. Not everyone gets enough selenium in their diet. Not everyone has a really good supply of these converting enzymes. And so your T4 may be abundant and telling your TSH that we don't need to secrete TSH, but you don't have any or enough T3, and you're tired all the time, and you're cold all the time, and your hair is falling out, and your skin is dry. And then it leads to depression, and that leads to pain, and so on and so forth. Also, we need to look for thyroid antibodies, because autoimmune thyroid disease, also known as Hashimoto's thyroiditis, is epidemic right now. I don't know why. I don't think it was heard of in my parents' generation, and now so many people of our generation have this. More women than men. Definitely happens to men too. So we have to look at thyroid antibodies. Are they present? Is your body attacking your thyroid gland? If it is attacking your thyroid gland, you're going to get periods of time of inflammation in your thyroid and all this blood in your thyroid, and you're just going to get a huge release of thyroid hormone into your bloodstream. It's going to give you mania. It's going to give you tons of energy, feeling a little wired, and then you're going to crash. And that's how thyroid autoimmunity often shows up. There's also, unfortunately, this phenomena in organic chemistry that you could have two molecules that are identical but mirror images of each other, like your right hand and your left hand. And T3 is a handed molecule, and you could have something called reverse T3. I know this sounds crazy, but it's true, where it's the same molecule, but it's the mirror image and it doesn't work in your cells. Your cells don't like it. They want the left-handed one. So you have to test for reverse T3 as well. So you can get a full thyroid panel and really get a sense of what your thyroid's doing. Just a reminder that a blood test is a snapshot of what your blood was doing that day. It doesn't necessarily tell you what the trends are, whether it's fluctuating wildly, going up and down, or is it steady. Another thing we look for a lot is vitamin D3, especially in northern latitudes like where I live. But even in southern latitudes, a lot of people just live their lives inside. They don't get enough sunlight and they get deficient in vitamin D. So you can supplement vitamin D or you can make your own with enough sunlight. But vitamin D is so crucial for mood, immunity, bone health, and we don't even know what else. There's tons of research being done in vitamin D3 that people are still figuring out all the things that this vitamin does. It's actually what we call a protohormone. We still call it vitamin D3, but we know it's a protohormone. There's another very common issue. It's about 20% of us in North America called MTHFR deficiency. So MTHFR stands for methyl tetrahydrofolate reductase. Anything that ends in ACE is an enzyme. So this enzyme catalyzes the metabolism of B12 and folic acid, and it is crucial. B12 and folic acid are everywhere, and methyl donors and all kinds of biochemical things that they do for hormone balance, brain chemistry, energy production, bone health, joint health, detoxification. Almost every system in the body depends on B12 and folate. And if you're one of those folks who were born with this genetic defect, it's a mutation that is passed from parent to child, you're going to have problems with methylation, which can cause so many different issues: mood, energy, detoxification, inflammation, infection, immunity, all these things. So a lot of times we do give, it's just a simple matter of giving the methylated form of B12 and folate to the patient, kind of bypassing this deficient enzyme and supplying the body with what the enzyme would supply it with. And this is a fun one because people can really feel better in a couple of weeks on the right supplement here. Another very important blood test that we do is testosterone, not just for men, but for women too. Testosterone gives you energy, psychological energy as well as physical energy. And in your complete CBC, you can get a look at your hemoglobin and your red blood cells and see, are there any signs even of a mild anemia? And if a person has chronic fatigue and there's even a mild sign of anemia, I think that should be treated. I think that should be looked at. The next one we look at is the Comprehensive Digestive Stool Analysis, or CDSA. And I should say I don't do all these tests on everybody, but sometimes we do. CDSA, you poop in a box and you send it to the lab and they analyze your stool for all kinds of things. It tells us about your digestion, your absorption, your gut biome, your immunity and immunology and inflammation that's happening in your gut. So remember, the urinary organic acids test told us about your small intestine. The stool tests tell us about your large intestine. Both are super duper important. So once we gather the information, what do? What are our interventions? Well, many. And we do whatever we need to do and whatever the patient is capable of doing. And remember that when depression and fatigue are major parts of this issue, especially a person may have tried so many things over the years that they just may have treatment fatigue, you do what you can. So we pick and choose. I give people, here's everything I think that would help you, and then you decide what fits for you logistically, financially. Diet and supplementation. So you got to get the right foods in and you got to get the wrong foods out of the diet to support the challenged metabolic pathways, supply the chronic needs and deficiencies, and try and reduce the allergic load on the body. Let's say you have airborne allergies and you have food allergies. Well, you have to breathe, right? But we can control, to some extent, what you eat. So if we could take the allergens out of your diet, the airborne allergens won't have as much of an effect on you because your total allergic load will be lower. So allergy and intolerance strategies, targeted medication. Now, I don't prescribe in my license, I cannot prescribe, but Lots of people can and do and will work with me for hormone replacement, antimicrobials, antifungals, anti-parasite types of medications. Sometimes we can just get a big boost to the immune system or the hormonal system through providing it from externally. We talk about aerobic conditioning, and that's personalized to the patient depending on their pain situation and how much energy they have. But we got to start getting oxygen to your cells, and we got to start getting blood distributed. Because if you're sedentary and you're not circulating, it doesn't matter what you eat, it's not getting to the cells. It's not going to make a difference for you. Me being a chiropractor, of course, I am partial to manual therapy, improving pain, improving circulation, improving mobility. All of these things have a huge impact on quality of life, as well as metabolism and also mood, especially depression, anxiety. Touch can be huge for those things. We bring in the psychotherapy and we can tailor that. I don't do it, but we'll find someone to help you. It's kind of harder and kind of easier now since COVID. Everyone's in therapy, but also telehealth is there and we're all used to it. So you can find a therapist that lives somewhere else and they work for you. You talk to them on Zoom and it works great. And I mean, basically, once you have done the assessment, if you've done it right and complete, the interventions kind of present themselves, right? If we see anemia, we treat anemia. If we see infection, we treat infection. If it's chronic stress, we try to build up the person's resistance to stress and encourage good rest and nourish the body. So this is my talk on chronic pain, fatigue, and depression. Again, it's not simple. It never is. I'm not saying that it should be. But a lot of times we can help. And I know there's a lot of doctors out there that just don't know. They don't understand the issue. They don't know how to help. But I'm one that can help and wants to help. So if you've watched this far, 40 minutes, thank you, congratulate you. You should probably get in touch with me. Let's have a talk about your health or the health of your loved one and see if we can make any changes for the better. Dr. David Russ signing off. I really appreciate you watching.